Welcome back to the deep dive. Today we're opening up our source material on a condition that, well, it affects millions, but it's still so widely confusing. I'm talking about rosacea. If you're dealing with that persistent redness on your face, or maybe sudden stinging, or even those acne-like bumps that just don't go away, this deep dive is for you. We're going to try and get beyond the basics.
That's absolutely right. I mean, rosacea is so much more than just having sensitive skin.
Right.
It's a chronic inflammatory disorder, and it specifically hits the central parts of the face, so your forehead, cheeks, nose, and chin. The single exact cause. We still don't know it, but our mission today is to give you a clear roadmap. We'll look at the factors, the different ways it shows up, and most importantly, the strategies for actually managing it.
Okay, let's unpack that. The word that stands out to me is chronic. This isn't something that just comes and goes, is it?
Yeah, not at all. It's a long-term thing. You'll have flare-ups that last for weeks, maybe even months, and then periods where it seems to calm down. That cycle can be incredibly frustrating.
And we should probably say this right at the top just to be super clear.
Yes.
It's not contagious.
Absolutely not. It is not contagious. This is a deeply personal condition. It's driven by your genetics, your vascular system, and then amplified by external triggers. You can't catch it from someone.
Okay, so let's start simple then. What's the core definition? We hear redness, visible blood vessels, bumps. But what does that actually look and feel like, especially in the early stages?
Well, the symptoms usually start pretty subtly and then get worse over time. The most recognizable sign is that persistent redness, what we call erythema.
Erythema, okay.
And that redness is just a direct result of the small blood vessels under your skin being constantly dilated. Over time, those tiny vessels can actually become permanently visible.
Ah, so those are the thin red lines you sometimes see, the broken capillaries.
Exactly. We call that telangiectasia. And once they're there, topical creams won't really make them disappear. That's where things like laser treatments come in later.
It's not just what you see, right? There's a feeling associated with it.
A huge part of it. Even in mild stages, people report burning, stinging, or this intense itching, and it can be triggered by something as simple as a change in temperature.
And the flushing, that sudden, intense wave of heat and redness.
Precisely. That flushing is often one of the very first signs. It's an immediate response to a trigger. And while it can stay mild, in some cases, it can progress to something more severe called rhinophyma.
Okay, what's that?
It's where the skin on the nose thickens and gets larger, creating a sort of bulbous look. It's less common, and we see it more often in men, but it's the most severe physical manifestation.
This is where I think the information gets really critical. Rosacea isn't just one thing. Our sources say it has 4 distinct phases or subtypes.
Exactly. And knowing which subtype you have is the key to getting the right treatment. You don't want to be using an acne treatment for vascular redness.
Makes sense. So let's start with the most common one, the one that's all about redness and blood vessels. ETR.
Yes, erythemototelangiectatic rosacea. EPR for short.
Definitely for short.
This is your classic persistent redness type. You have that constant central facial redness and the visible blood vessels we just talked about. The skin is highly sensitive, stings, burns easily.
And this is the important part, no pimples.
No pimples, no bumps or pustules. It's purely a vascular and sensitivity issue.
Okay, so that's type 1. What about the next one? The one that looks so much like adult acne.
That would be papulopustular rosacea. Some people even call it acne rosacea, which is a bit misleading.
Why is it misleading?
Because the cause is completely different. Traditional acne comes from clogged pores, oil, bacteria. But these bumps, the papules and pustules in rosacea, they're caused by pure inflammation and swelling. The pores aren't clogged.
That distinction is so important. So if someone thinks they have acne and starts using, I don't know, a harsh salicylic acid wash.
Oh, they'll make it so much worse. Almost always. Those products strip the skin barrier, which is already fragile in people with rosacea. You just end up with more irritation, more redness, and an even bigger flare-up. It's a classic misdiagnosis cycle.
Okay, that's a huge takeaway. Then there's the third type, phometus rosacea.
Right. This is where we see that physical thickening of the skin we mentioned earlier with rhinophyma.
So it's not just the nose.
The nose is the most common spot, but it can also affect the skin on the chin, the forehead, even the ears and eyelids. It's usually something that develops after years of untreated inflammation.
And finally, the fourth type is, it's not even about the skin, it's ocular rosacea.
Yes, and this one is so often overlooked. It affects the eyes and eyelids. You get chronic redness, dryness, itching, that gritty feeling like there's sand in your eye.
Hmm.
People often get frequent styes or swollen eyelids, and it needs medical attention because if it's left untreated, the inflammation can actually damage the cornea and affect your vision.
Wow. It just shows you it's a systemic condition, not just cosmetic. Okay, so we've got the symptoms and the subtypes. Let's talk about the why, the underlying causes. Genetics seems to be a big one.
A very big piece of the puzzle. If someone in your immediate family has it, your chances of developing it go way up.
And beyond genetics.
We see issues with the blood vessels themselves. They're just overreactive and dilate too easily. And there's also an immune system component, where the body sort of overreacts to normal things on the skin, which creates chronic inflammation.
This is where it gets really fascinating for me, the microbial link. I was surprised to read about Demodex mites.
Right, let's talk about Demodex. These are microscopic mites that live in the hair follicles of pretty much every single adult. They're normal.
Wait, on everyone. So they're not the problem themselves.
It seems to be more about the quantity and the immune response. In people with rosacea, you see much higher populations of these mites. But more importantly, their immune system just freaks out about them.
So my immune system might ignore them, but someone with rosacea has an inflammatory reaction to their presence.
That's the theory. A normal immune system doesn't even notice them, but a rosacea-prone immune system sees them, or the bacteria they carry, as a threat and launches an attack. And that attack looks like redness and bumps.
That's incredible. And it explains why certain treatments work, right?
It does. Topical treatments like ivermectin are sometimes used specifically to reduce the mite population, which then calms down the inflammation.
And then there's the other surprising link to the gut, specifically a bacterium called H. pylori.
Yes, Helicobacter pylori. This is the bacterium that's famous for causing stomach ulcers.
So what's the connection to your face?
It's complex, but one leading idea is that H. pylori can cause the body to produce more of a protein called gastrin. And gastrin is a known vasodilator.
Meaning it widens blood vessels.
A powerful one. So more gastrin in your system could lead directly to more facial flushing and persistent redness. It's a perfect example of how your internal gut health can show up on your skin.
That's amazing. Okay, so from internal causes, let's go to external triggers. This is the stuff that pretty much guarantees a flare-up.
Absolutely.
Yeah.
And trigger management is the cornerstone of living with rosacea. The #1 trigger, hands down, is sun exposure.
The sun.
UV radiation is a massive instigator of inflammation and vessel dilation. After that, you've got extremes in temperature, hot or cold wind, humidity, all common culprits.
And a diet list. For anyone who loves spicy food or a glass of wine, it can feel a little punishing.
It can be tough. Spicy foods, alcohol, especially red wine, and even hot beverages like coffee or tea all increase your body temperature and send blood rushing to your face. Instant flush.
And what about stress? That connection is so real.
It's a huge trigger. When you're stressed, your body releases cortisol and other hormones that cause blood vessels to dilate. You can literally see the stress appear on your face as redness. Vigorous exercise that causes overheating is another big one.
So it sounds like keeping a trigger diary is probably the best advice you could give someone.
It's the gold standard because triggers are so personal. A diary helps you figure out, was it the wine? Was it the stressful meeting? Or the hot shower? It lets you build your own personalized avoidance plan.
Okay, let's get into management. Since this is chronic, you're not really curing it, you're controlling it. And if symptoms are bad, you need to see a dermatologist.
You absolutely do. Treatment is usually a layered approach. For the inflammation and bumps, we often start with topical medications.
Like creams and gels?
Exactly. Things like metronidazole or azelaic acid. They work really well to reduce that localized inflammation.
I also read that oral antibiotics are used, which surprised me. But it's not for an infection, is it?
That's a crucial point. Oral antibiotics like doxycycline are often used, but at what we call a sub-antimicrobial dose. It's too low to kill bacteria, but it's the perfect dose to act as a powerful anti-inflammatory.
So you're just using that side effect of the drug.
Precisely. You're using it to cool down the whole system and reduce the redness and the bumps.
Okay. And what about the things that medication can't fix, like the persistent redness or those visible vessels?
That's where procedures really shine. Laser therapy and intense pulsed light, or IPL, are very effective. They use light that gets absorbed by the red pigment in the blood vessels.
And that destroys them.
It damages the vessel walls, causing them to collapse and get reabsorbed by the body. It can significantly reduce that background redness. You usually need a few sessions.
I also saw a mention of something for immediate temporary relief.
Yes, there's a product called brimonidine gel. It works by constricting the blood vessels very quickly. The effects last for about 12 hours, so it's more of a cosmetic fix for a big event, not a long-term treatment for the inflammation.
Good to know. Okay, let's talk about the daily routine. This is what people can control every single day. What's the best way to care for rosacea-prone skin?
Meticulous but gentle. That's the mantra. Start with a mild, fragrance-free cleanser, and when you rinse, use lukewarm water.
Not hot.
Never hot. Hot water is a major vasodilator and will immediately make you redder.
And how you dry your face matters too, right?
It really does. You have to pat the skin gently with a soft towel. No rubbing. Friction is the enemy.
Okay, so after cleansing, what's next?
Hydration. A gentle, non-comedogenic moisturizer is key to strengthening that compromised skin barrier. Look for calming ingredients, niacinamides, ceramides, that sort of thing.
And I'm guessing the final step is sunscreen.
The non-negotiable step. Every single day, SPF 30 or higher. And for rosacea, mineral-based sunscreens are usually much better.
Why is that?
Mineral filters like zinc oxide and titanium dioxide sit on top of the skin and physically block the rays. Chemical sunscreens work by absorbing UV, which can create heat and sometimes contain ingredients that sting or irritate sensitive skin.
What about exfoliating? So many people feel like they need to scrub their skin.
For rosacea, you have to limit or just completely avoid harsh scrubs and strong chemical exfoliants. Over-exfoliating will just destroy your skin barrier and lead to a massive flare-up.
This deep dive has really shown how complex this all is. It's this chronic disorder with 4 subtypes, driven by everything from your genes to your immune system, and then set off by a list of very personal triggers.
Exactly. And the bottom line is that while you can't prevent it from starting, you have tools. Consistent gentle care, meticulous trigger avoidance, and early medical treatment, those are the keys to managing it and improving your quality of life.
We spent a lot of time on the surprising link between these microscopic things like Demodex mites on our skin and H. pylori bacteria in our gut and the inflammation we see on the face. It really leaves me with a final thought for you to mull over. Considering how prevalent these internal and microscopic factors are, how much more research is truly needed to fully map out how our body's entire ecosystem, from deep gut health all the way to our immune responses, actually drives the visible chronic symptoms of a condition like rosacea.